Assalamu alaikum and very good evening. I welcome all to the 17th online discussion session organized by Other Health Bangladesh. We also convey Eid greetings, Eid Mubarak. This is Delwar Hussain, Assistant Professor, Sher Bangla Agriculture University and member Other Health Bangladesh will be with you tonight. Ladies and gentlemen, tonight we are going to discuss on small ruminant medicine. Small ruminant medicine is very important from clinical perspective for veterinary practitioner and final year students. So we invited a resource person from the India, Dr. Shivaraman sir, for sharing knowledge on the correct diagnosis and management of important clinical conditions and diseases of small ruminants. I will give a brief introduction about our research person, Dr. Shivaraman sir. Although he is very popular and well-known person to every practicing veterinarian in Bangladesh and India. Dr. Shivaraman sir had completed his Doctor of Veterinary Medicine degree from Madras Veterinary College in 1995. Subsequently, he completed MSc from the College of Veterinary and Animal Sciences, Kerala, on Clinical Veterinary Medicine in 1997. Then, in 2010, he joined as Assistant Professor at Veterinary College and Research Institute, Namakkal. He further completed his PhD on clinical evaluation and therapeutic strategies in Downer's cow syndrome. He has published more than 60 articles in different national and international scientific journals. Dr. Shivaraman sir has vast experience on handling large animal cages. His major expertise in veterinary clinical medicine and also specialized experience in the large animal internal medicine and small animal internal medicine. He is very famous among the veterinarians both in Bangladesh and India due to his innovative clinical ideas. So today, Ada Health Bangladesh is very much delighted to have Dr. Shivaraman sir in our two-night session. Welcome, Dr. Shivaraman sir.
Thank you. Thank you very much,
In this session,
Delaware.
thank you, sir. In this session, we also have 7 colleagues to contribute on tonight's discussion. For the discussion, we have Dr. M.D. Ahaduzzaman sir, Assistant Professor of Department of Medicine and Surgery from Program Veterinary and Animal Sciences University, Sibasu. We also have Dr. M.D. Arifuddin, Upazila Livestock Officer of Upazila Livestock Office and Veterinary Hospital, Jondonesh. We also have Dr. Ridwan Pasha, Lecturer of Department of Physiology, Biochemistry and Pharmacology from Sibasu. Professor Dr. Mizanur Rahman is also here. Dear veterinarian, this online program is live on official Facebook page and Facebook group and other YouTube channel of Other Health Bangladesh. Before moving to the presentation, I would like to request to the audience, please drop your valuable questions in the comment box and share the program. At this stage, I am cordially requesting Dr. Shivaraman sir for sharing his presentation. So, ladies and gentlemen, we are waiting for the Dr. Shivaraman sir. Sir, the floor is now yours.
Thank you, Delaware. Delaware, is it okay? The screen is available?
Yes, sir. It's fine, sir.
Yes.
Thank you.
Okay, thank you. So thank you very much for Dr. Mizan and his team for giving me the opportunity to have this presentation on small ruminants medicine in Other Health Bangladesh. So first of all, I would like to express my warm good evening to all the veterinarians of Bangladesh, practicing veterinarians of Bangladesh in this evening session. So I would like to thank Dr. Mizan for his wonderful job in making awareness regarding the Other Health Bangladesh and this program, creating awareness among the farmers and creating the awareness among the veterinarians and updating the knowledge of the veterinarians through this project under Health Bangladesh. So in this today's session, we are going to see some of the clinical cases of small ruminants medicine. So actually, when compared to the large animal internal medicine and small ruminants internal medicine, during when you have a discussion with some of the faculties or veterinarians, at the earliest phase, they used to say rearing sheep and goat is a very easy one, and very little, small, very few number of diseases only will be there. Very few number of diseases will be noticed, so there won't be any problem like that. So when we come to the practice, actual practice in the small ruminants, we come across many number of clinical cases, many number of clinical cases, same like that of a large animal. Here, management plays an important role, nutrition plays an important role, disease control plays an important role, management of neonates is very important. So we have to be in thorough regarding the clinical aspects, clinical diagnosis, appreciating the clinical science, management, nutritional. All these things plays an important role in identifying the clinical cases or disease diagnosis in small ruminants. That's why we used to say we need more experience in small ruminants, appreciating the clinical science. Once you appreciate the clinical science, once you appreciate the clinical conditions, you can easily diagnose the case in a flock, identify one or disease in a case in a flock. You can prevent the condition, prevailing disease in that flock very easily. So appreciating the clinical science is an art in small ruminants, according to my practice. So keen observation is plays an important role in appreciating the clinical science. Getting the history is also important. So in this session, I am going to highlight only a few clinical cases, very important clinical cases, not all the clinical cases. If I'm going to take a session of all the small ruminants medicine, as if the topic says small ruminants medicine means, if I'm going to discuss about all the clinical case, I cannot finish it in 1.5 hours or 1 hour. It will take 1 day. So that much clinical cases are there. Each and every cases, if you go in depth, that will be a different one. But in this session, I'm going to deal only about a few clinical conditions in which the commonly, which we are coming across in our practice. The veterinarians who are practicing the field, they used to come across in the field conditions. Just by seeing the clinical science, they can appreciate the condition, they can treat it well. And this session will be a very good awareness for you to identify the clinical cases. And the next step, we can go in depth of the other clinical cases and we can study. Okay. So I'm little bit, I'll be going fast in some of the clinical cases so that you can have an idea in this session. You can see the picture, you can have an idea about the clinical case, and you can have an idea about the treatment and the prevention or whatever may be the thing. And so that when you come across the case, definitely you will have some idea regarding the diagnosis of the small ruminants. So in later, when you go for individual cases, individual discussions in depth, so you can understand well. So here I think I will concentrate regarding the clinical cases by seeing the pictures or videos, so that you can identify or diagnose very easily. So when coming to the normal vital parameters of sheep and goat in the small ruminants, the normal rectal temperature, you have to keep it in mind, is 103 to 104. When you compare with the large animal practice, the large animal practice 102, 102.5 is the normal temperature, that is 38.5 degrees centigrade. Here 103 to 104 is the normal temperature. So many of us, when you see the temperature, they used to say, even the farmers, they used to say the animal is having temperature, pyrexia. So if you ask the how much about the temperature, they'll be telling 103 or 104. 103 to 104 is a normal one. So beyond 104 is the pyrexia in sheep and goat. And the heart rate is 70 to 90 beats per minute, and respiration rate 12 to 20 per minute. Any increase in the respiration rate, naturally you have to rule out the respiratory tract involvement or any other ruminal acidosis or associated clinical signs. The rumen motility is 1 to 2 per minute. So these are all the basic vital parameters we have to keep it in mind for identifying the normal cases and clinical cases. So just I am going to highlight regarding the common disease conditions which we are coming across in our field conditions. Just I am telling the name alone for your awareness. I am not going in depth of the each and every disease. Regarding viral disease, the common conditions we are coming across in the field conditions in sheep and goat is a PPR. One of the major things is a PPR. Everywhere it is sheep and goat. PPR is very common. Next viral disease is a blue tongue. and we come across sheep pox and goat pox. These are all the common viral diseases. And regarding the bacterial diseases in small ruminants, we used to come across actinomycosis, anthrax. Sometimes you may be having a flock of goat or sheep, some sudden mortality will be there. So in sudden mortality, I mean sudden death, you have to think about anthrax. So in pasteurellosis, caseous lymphadenitis, tetanus, botulism, enterotoxemia, listeriosis. These are all the common bacterial clinical conditions we come across in sheep and goat. Regarding the parasitic, the very common thing is Haemonchus, Contractus, Monocia, Senerosis, and ectoparasites like lice and ticks plays a major role in the small ruminants. So the ectoparasites, I will be discussing regarding the ectoparasites separately. And many of you may not be heard about these conditions like watery mouth. I'll explain what is the condition is called watery mouth condition in small ruminants. That too in neonates. It's a condition in neonates. And vitamin A deficiency. It's very easy to diagnose, very easy to appreciate the condition, very easy to treat it also. And weak kid syndrome, nutritional muscular dystrophy, joint ill or otherwise called as navel ill. Why I am highlighting, I am listing out all the disease conditions for our self-review. When I am telling all these conditions, you have to keep it in mind whether you have seen all these cases in your practice or not. So you can list out of listing these diseases, how many diseases I have seen in our these much years of practice, 5 years or 10 years of practice, how many clinical conditions, whatever mentioned, I have mentioned here, we have seen. Like that for self-review, I am telling all these things. Then pediculosis, that means lice infestation. Pulicosis, flea infestation. Deworming schedule, how to deworm a flock, how to deworm an individual animal. Okay, pneumonia, how to treat the pneumonia cases. Tetanus, enzootic ataxia. These are the common clinical conditions. Like ruminal acidosis, this is very common. Ruminal acidosis is very, very common because of the feeding of more carbohydrate. Ruminal acidosis is very common in small ruminants also. And lantana camera poisoning, it's regarding from the plant, lantana camera plant poisoning. And blood protozoan disease is very common nowadays, especially like anaplasma, theileria, and babesiosis. And mange, sarcoptes, soraptis, as outbreak in a flock is very common. And bacterial dermatitis and contagious caprine pleuropneumonia that you could have come across in the field conditions. Many number of mortality in sheep and goat, which could be due to contagious caprine pleuropneumonia. So these are all the common conditions which we come across in our clinical practice. That means not only this alone, there are many other conditions. According to the time availability and the presentation of the cases, I have listed out these things. And we will see one by one in nutshell. Okay. So regarding the lice infestation, we used to call as pediculosis. Lice infestation is pediculosis. It's a lice infestation, the flea infestation is the major common cause for anemia in small ruminants, especially in kids, lambs, and sheep and goats. It's a common cause of anemia and the least bothered by the farmers and also the veterinarians. Whenever they are presented with any ailment or anemia, we won't bother about the ectoparasites. We will be concentrating on the endoparasites alone. So whenever there is a lice infestation, pediculosis, the animal will be always having itching will be there. Rubbing will be there. Rubbing, the animal will be rubbing on the floor or in the any other object like that. White crust will be noticed on all over the body region, and anemia is predominant or prominent. You can easily appreciate. So here you can see the picture. Small white like dust like things are there in the skin. So it's a clear indication of lice infestation. So all the animals which are presented with this type of lesions, you can appreciate very easily the lice infestation. Okay. See the mucous membrane will be blanched. So pale mucous membrane. Sometimes the mucous membrane will be blanched with edematous. So blanched with edematous is indicative of hypoproteinemia. Naturally, it's a case of hypoproteinemia with either it may be ectoparasites or endoparasites. You have to go for a clinical examination to rule out whether the animal is having lice or flea infestation. See the mucous membrane is very much blanched, pale in nature. Edematous also. Okay. So here you have to rule out whether there is any presence of ectoparasites like lice or flea or endoparasites. So how to rule out the ectoparasites? See, just you have to make your hand and just you have to see the underneath the hair. You make opposite the flow of the hair and in the base of the hair you can able to see all the small black dots like things. They are either it could be a lice or a flea infestation. So if you have a microscope, just to plug the small that black spots or the organisms which are moving, and put a drop of liquid paraffin and focus it under low power microscope. You can very well easily appreciate what is the presence of, whether it is a lice or a flea, and you can treat it accordingly, and you can treat it successfully. It's a small procedure of a clinical examination so that you can prevent the loss to the farmers. See here, we have to see it like this. So you have to see it like this in the base of the hair, underneath of the hair. So there are a lot of small things or organisms will be moving on. So you have to verify whether it is a flea or a lice. So under the microscope, low power microscope, when you are able to see the organism like this, it is a case of sucking lice. So it's a sucking lice, and you have to differentiate from the sucking lice and biting lice. So here the sucking lice, there will be a long head. The head will be very much long. That is sucking lice. Big head, B for big. Big head means it is a biting lice. So that you can easily differentiate by morphological identification. Okay. So you can also differentiate the other things. So whether it is a sucking lice or biting lice, and you can treat it accordingly very easily. So very easy to treat it accordingly. See, it's a sucking lice, a long neck. So if the head is big, it is a biting lice. So once you identified the lice infestation in an individual animal or in an animal in the flock, you have to treat all the animals because it will be there in all the animals. So in case of sucking lice, you can give ivermectin. As we all know, the ivermectin dose are 200 microgram per kg body weight. You can give subcutaneous, or otherwise you can give orally also. And in case of biting lice, you can give the external application with the insecticides. So you can treat it with the ivermectin, and also you can give the external application with the insecticides like cypermethrin, deltamethrin, flumethrin. All these things can be used. You can use 4 ml in 1 liter water, 4 to 6 ml in 1 liter water, and you can apply for the external application weekly once for 1 or 2 weeks. The conditions will be improved. And the next thing, you have to manage the anemia by giving supplements, and you can manage the anemia. If the anemic is very much acute anemia, is there, if the PCV is less than 15, then you can go for the blood transfusion. Nowadays, blood transfusion is very common in small ruminants also. You can use very easily, you can do very easily the blood transfusion in small ruminants. So when you see any structure, anything in the microscope like this, it is a flea, Tenocephalides felis. It's very common in the lambs and kids and in the flock, and it is one of the major cause of anemia. It goes unnoticed. So whenever you come across a flea infestation, you have to go for fipronil spray. So these ivermectin and all are not at all useful for controlling the flea infestation, and the ectoparasites application like deltamethrin, flumethrin are not at all useful or applicable. I mean, it won't get that much improvement in case of controlling the flea. Only the thing you have to go for fipronil spray. So fipronil spray are commercially available in the market, that you can get it and you can spray it over the body, and you have to spray beneath the skin. Just you pave the way of the hair with one hand, and you can put the spray in underneath the skin, so that the flea infestation will be under control. You can put it in both the sides, both the thorax side and the left side and right side and the dorsal aspect, so that weekly once or once in 4 days you can put the spray, so that the flea infestation will be under control. So this technique is a very simple technique, simple clinical diagnosis, simple identification, will save the animal from anemia, and economic loss will be prevented. So you can just try in the farm and you can treat it accordingly. Okay. And regarding the small ruminants, many of the veterinarians, we may be having some doubts in where to give the injections. The intramuscular injection always prefer the neck region. Always you give the intramuscular injection is preferable in the neck region, and the subcutaneous also you can give in the neck and the dorsal skin in the kids. And intravenous you can always prefer the jugular vein is always preferred, and the recurrent dorsal vein can also be preferred. So in case of small animals, they mean small ruminants, the intramuscular injection, you can use the 20 gauge needle can be preferred for giving intramuscular injection, and you can use the scalpel needle for intravenous injections. So here you can able to see the knuckling of the fetlet. This is due to faulty injection. Okay, so due to the peroneal nerve paralysis, due to the faulty injection, when you are giving the injection in the thigh region, that will lead to the peroneal nerve paralysis. So you have to be careful always whenever you are giving injection, that go for the injection of all the intramuscular injection in the neck region. So you might have a coming across this type of clinical condition. It's called watery mouth. In small neonates, 1 week old neonate, you will be coming across this type of clinical cases, the field conditions. Many of the veterinarians, they will feel some intoxication or some poisoning cases, and they used to give atropine sulfate, and that is not advisable. The history will say the animal is a neonate, cowed 1 week back or 2 days back or recently cowed. So this type of condition is due to E. coli infection. This is a condition called watery mouth due to E. coli infection due to the unhygienic environment in the farming conditions, or the animal may be delivered in the unhygienic environment. So the kids may be reared in the unhygienic environment. They will easily get the infection from the environment, E. coli infection, and they will have a profuse salivation. Either it may be a profuse salivation or a frothy salivation. Okay. So the owners, they will take the cloth and they will be wiping out the mouth frequently. Again and again, salivation will be coming. So they will be thinking that some intoxication, some poisoning occurs. So it is a case of watery mouth due to E. coli infection, neonatal E. coli infection. See, the systemic environment of E. coli infection is there, and salivation is there. The animal is lethargic and in the lateral recumbency. Okay. So the temperature may be variable. Some animals may be having temperature, some animals may be normal to subnormal temperature. Frothy salivation to profuse the salivation will be noticed in such a cases. So this type of cases will well respond to amoxicillin. You can give antibiotics. Either you can go for amoxicillin 20 milligram per kg body weight, or ceftriaxone or any other broad spectrum antibiotics. And you can give flunixin 1.1 milligram per kg body weight intramuscular, and you can give some fluids. Fluids means neonates, they'll be having only few kg, 3 or 2 to 3 kg will be there. So you can give just 10 ml of ringer latte or normal saline, whatever may be available. Okay. So broad spectrum antibiotics like amoxicillin or ceftriaxone can be given. Flunixin can be administered and fluids can be administered for 3 to 5 days. The animal become normal when it is presented earlier. Okay. So this is condition called as watery mouth. So keep it in mind. It's a case of watery mouth. You can save the kids, this type of kids. And the next condition is called a floppy kid syndrome. Many of you would have come across this case. The exact cause is not known, but this type of floppy kid syndrome is very common in case of neonates. It could be due to excess consumption of excess administration of milk or excess consumption of milk by the kids. That will lead to the proliferation of some organisms like Clostridium in the abomasum, and the changes in the acidity and the pH changes occurs in the digestive tract and leads to the coma stage. So all the animals will be presented in the coma stage. When the animals are fed with over feeding of milk, suddenly they will go for lateral recumbency and they will be in the coma stage. So you have to differentiate from neonatal infection. The same thing, E. coli infection, and this will be same condition that will be presented. And you have to differentiate. Here the distension of the abdomen will be predominant. See here, when we palpate the abomasum in the abdomen will be distended, from predominantly distended with milk, and all the animal will be in the lateral recumbency, the cold extremities, and the animal will be in the coma stage. Okay. So this is after treatment. You can very well treat it with sodium bicarbonate, either orally or intravenously. Just accordingly 1 ml per kg body weight. Suppose 3 kg means just take 3 ml of sodium bicarbonate, give very slow IV, and give some fluids, normal saline or ringer lactate, and even orally also you can give sodium bicarbonate, and restriction of milk is advised, and treat it symptomatically. Energy supplements can be given. The animal become normal. So this is called the floppy kid syndrome. Once you diagnose, you can very well save this type of animals, and the recovery will be very nice. The other things are the weak kid syndrome. You might have come across some conditions called weak kid syndrome. Is the animal will be normal. It will be taking consuming milk. When you feed milk, the kids will be taking the milk and all, but it cannot able to walk normally. So all these animals will be like this. Small kids, they are unable to walk. There will be debility. They will be recumbent. So when you give feeding, so it will take some milk. Otherwise, they will be sometimes some animals will be in the coma stage. Some animals cannot able to walk. Subnormal temperature will be noticed. Okay, they are unable to bear weight. So mostly the colostrum deprived animals are prone for a weak kid syndrome. So 2 or 3 kids may be there. Sometimes in the farm poor management, colostrum deprived animal, not if they are not fed with the colostrum within 6 hours to 8 hours, these animals are prone for neonatal infection, and this will all lead to weak kid syndrome. So it's of multiple etiology. Sometimes they will be having a staggering gait, incoordination, all these things will be there because of nutritional deficiency also. So according to the clinical science, we have to treat it. So the some cases it will be presented with the tachycardia, dehydration. Okay. So if there is any dehydration, you have to supplement the fluids. So either you can give oral fluid therapy or subcutaneous fluids you can be given. Okay. So treatment is a symptomatic treatment according to the individual cases. Once you identify this, you can give vitamin A and vitamin E, and the selenium can be given daily. So vitamin A is available as an injection, you can give. Vitamin E, selenium also can be given as an injection. Antibiotics if needed. Whenever you come up, when you think about that, if there is a neonatal septicemia or neonatal infection like E. coli infection, you can go for antibiotics. Flunixin to counteract endotoxemia, you can give 1.1 milligram per kg body weight. And fluids like normal saline and rigor lactate can also be supplemented. Colostrum deprived means colostrum deprived means if you are giving colostrum after 8 hours, there is no need of giving the colostrum after 8 hours. You have to give the colostrum for the newborn animals before 8 hours. That you have to keep it in mind. Electrolyte supplements can be given orally. You can take the electrolyte powder. Electrolyte powders can be mixed in the feeding bottle, and you can supplement oral feeding can be supplemented to this type of kids, so that slowly we can pick up all these type of animals with better management and care and management of weak kid syndrome. Okay. So regarding artificial colostrum, so how to feed the orphan kids and lambs? So you have to take 600 ml of fresh cow milk can be taken, and one egg yolk can be beaten well, and you add 1 spoon of glucose in that, and 1 spoon of cod liver oil or castor oil can be mixed. All this mixture can be mixed well, and you can divide the mixture into 4 equal parts, and you can give it to the small kids in the feeding bottle. So whenever there is orphan kids or lambs, so you can go for artificial colostrum. You can prepare the artificial colostrum and you can feed this type of animals, so that we can save the neonates from early mortality. I mean the neonatal infection. So this type of feeding bottle can be used for feeding. Oral rehydration can be used. Either you can use electrolyte powder can be given. Electrolyte powder can be mixed in the feeding bottle and you can give. So whenever the kids having a diarrhea, enteritis is there will be severe dehydration. If you are not able to give the intravenous injection for all the animals, you can supplement oral rehydration can be very well given. So when you have to give the oral rehydration means whenever the animal is having suckling reflex, oral rehydration is the best one. Whenever the animal is not having a suckling reflex, so the best thing is go for parenteral fluid therapy. Intravenous fluid therapy is the best thing. So if the animal is having, how to identify the suckling reflex? Just to put your finger in the oral cavity, in the mouth of the kids or lambs, they will start suckling. So the suckling reflex is present, so that you can give the oral rehydration to such a type of animals. So very good improvement will be there. So the another clinical condition is hypovitaminosis A. So the newborn animal, day-old animal. You think about day-old animal. Some materials they used to ask the differentiation between polyencephalomalacia and hypovitaminosis A. I will tell you back. This hypovitaminosis A, it occurs at the day-old. Polyencephalomalacia during the day-old or during the first week of during the first week, the animal will be normal, active, everything, the gait, everything will be normal. After a few weeks only, it will develop neurological signs that you have to suspect polyencephalomalacia. But in hypovitaminosis A, in day old itself, the animal will be having staggering gait, incoordination, unable to walk. The animal will be in the lateral recumbency. The rotation, the classical thing is the rotation of the head will be that due to the increase in the intracranial pressure. See in this video, the animal cannot able to maintain the posture, and it is a lateral recumbency, and it cannot able to stand. The rotation of the head will be prominent because of the increase in the intracranial pressure. Okay, so like this, the rotation of the head will be there like this. So when you make the animal stand, it cannot able to stand properly. It's a day-old kid. See, it is after the treatment. You can treat it with vitamin A injection, 440 units per kg body weight daily, intramuscular injection. So vitamin A injections are available as a oil preparation. Injections are available that you can give intramuscular. So you can give vitamin A injection 440 units per kg body weight. Very good response will be there. Okay, you continue for 3 to 5 days or 1 week. Very good response will be there. Only the thing you have to identify the conditions. Hypovitaminosis A. And in this video you can able to see the animal is not able to stand properly, it cannot able to bear the weight properly, and see the neck is downward, so the neck, it cannot able to lift the neck is bent downward, flaccid, as if it is very flaccid. Okay, this is, you might have come across many type of this type of clinical condition in the farm. Okay, so this is nothing but a nutritional muscular dystrophy due to vitamin E selenium deficiency. So the animal cannot able to bear the weight. When you make the animal stand, the animal will be having staggering gait, lowering of the head will be there. So in such a type of cases, you can go for supplementation of vitamin E selenium. Injections are available that you can give the injections. Very good improvement will be there. So you should when you come across this type of cases in neonates, directly you can go for supplementation of vitamin A and vitamin E selenium, a combination, so that you can prevent this type of, you can treat this type of cases very easily. So nutritional muscular dystrophy due to vitamin E selenium deficiency. Okay. So you can see this video. It's a lamb, a 1 month old lamb, so having a gait like this, incoordination, and not able to walk properly, and the frequent jerking of the hind limb is noticed. So many of us, they will be thinking some other condition is nothing but enzymatic ataxia, otherwise called as swayback, due to copper deficiency. It is due to copper deficiency. So because of the demyelination, progressive demyelination of the peripheral nerves, the animal goes for posterior paralysis like this. See, in this case, the frequent jerking of the hind limbs, progressive. The progressive paresis or progressive paralysis is a classical clinical sign of copper deficiency. Okay, you might have heard about the copper deficiency will exhibit only as a bilateral ocular alopecia and all. Not only like that, in sheep and goat, copper deficiency leads to posterior paralysis. So whenever you are coming across a case of posterior paralysis in the fast growing young animals like sheep and goat, you have to think about copper deficiency. So it's two forms are there. The congenital swayback is there, means during at the time of birth itself the animal will be having a posterior paralysis, and true enzymatic ataxia means acquired one. It's it is commonly noticed in the fast growing animal. After 1 or 2 weeks, or during the 1 month old, 2 month old, 3 month old, to the fast growth, whenever there is a copper deficiency, that may lead to progressive posterior paralysis. The reason is that there may be the availability of the copper will be very much reduced in such a cases, or in the farming conditions, or sometimes there may be some other factors which are conditioning factors which reduces the availability of copper, like excess molybdenum in the diet or excess sulfur in the diet may also lead to copper deficiency. Okay, that all we have to keep it in mind, and you have to see the feeding management, and you have to go for analysis of the feed, and you can come to a conclusion whether it is a primary copper deficiency or secondary copper deficiency. And the treatment is included as supplement copper daily orally. For goat 20 mg per kg body weight and sheep 30 mg per kg body weight, you can mix a copper sulfate solution and you can give orally daily. Slow and progressive recovery will be noticed in such a cases. When the cases is presented earlier, the recovery will be very nice. When the cases are presented in the delayed presentation, the response will be poor, and it depends upon the individual cases. Okay, in some places they used to give copper glycinate injections are available, that also can be used. Okay. When there are so many articles, they are saying that there are so many outbreaks of copper deficiency in the farm. So many outbreaks of in the lambs and kids are being reported. So many research articles are that, so that you can refer for further references. So other clinical conditions commonly we notice in the field conditions, the navel is very common. It's very common because of the poor management. So whenever the animal is the day old, after feeding the colostrum and all everything to the neonate within 6 to 8 hours, we have to advise the farmer how to treat it the umbilical, how to cauterize the umbilicus. So you have to put a knot and the umbilicus, and you have to cut it, and you have to apply povidone or tincture in the umbilicus, so that you can prevent the ascending infection through the navel lead. I mean, you have to can prevent the navel lead or joint. So you can prevent the bacterial infection through the ascending infection through the umbilicus. So when you are not going for the proper management, when you are not carrying the umbilical cord, or we are not cutting the umbilical cord and applying the povidone and all, they may go for a neonatal infection like E. coli infection, Fusobacterium necrophorum, and some other bacterial infection, Acrobacterium pyogenes. All it's very common. They will get the ascending infection, and they will get lodged in all the joints. They lead to polyarthritis. So that is called as navel ill or joint ill. Either it may affect one joint or multiple joints on that. So in the early stages, you can easily appreciate when you palpate the farmers. They used to bring the animal to the hospital with a history of that is not taking milk, and not is not active. When you see the temperature may be elevated. When you palpate the forelimb or hind limb, pain will be evinced. So that will be the earliest clinical sign: temperature and the pain evincing on palpation of the this one joints. So later the joint swelling will be very much prominent, and if you are not attending properly, and that will lead to abscess, and sometimes the abscess may be drained out. You have to treat it, open it as a abscess, and you have to drain out, and you have to keep the ceton or gauze. Sometimes it may lead to complications, and the fibrous tissue will come out and peel off. Septicemia will develop. All these are the complications of navel. See, the enlargement of the joints is noticed very prominent. So you have to treat it with the broad spectrum antibiotics. Either you can go for ceftriaxone, amoxicillin, either broad spectrum antibiotic. Of course, any antibiotic should be followed by a course. 3 to 5 days should be followed, and you can go for a supplement, other supportive therapy with dexamethasone can be given, or flunixin. Either you use steroid or NSAID. Any one can be used. You don't combine flunixin with the dexamethasone. Either one can be used to reduce as an anti-inflammatory. So antibiotic can be used, and steroids are non-steroid anti-inflammatory. Steroid means you can use a dexamethasone. NSAID means you can go for a flunixin, and you can apply povidone ointment. I mean, iodine ointment can be applied as a counter irritant, and if it is ripening, you can open it, and you can treat it as an abscess, and you can put a povidone gauze and treat it accordingly. So navel ill, you are coming across many number of navel ill in a farming condition, that indicates a poor farming management, and you have to make awareness to the farmers that on the day old you have to sever the umbilical cord and cauterize with the povidone to prevent this type of clinical conditions. And many of us will be having doubt what are all the antibiotics we can commonly use in case of small ruminants like sheep and goats. You can use the oxytetracycline. Oxytetracycline is preferable when you suspect a blood protozoan disease like anaplasma, babesiosis, and thalidosis. You can give 20 mg per kg body weight, and you can give it mix it with normal saline and give IV. Don't give OTC, direct IV. You can mix it with the NS and give IV. And some enterofloxacin also is very much commonly used in case of respiratory tract infection, and other broad spectrum antibiotic 2.5 to 5 mg per kg body weight you can give. Enterofloxacin is very commonly used in small ruminants, and you can use amoxicillin with the cloxacillin combination. Ceftriaxone is very commonly used in case of respiratory tract infection or other clinical conditions. Ceftriaxone is also very commonly used antibiotic. Gentamicin, whenever you come across gram-negative infections, you can combine the gentamicin 2 to 4 mg per kg body weight. Sulfa-trimethoprim is very commonly used in case of enteritis or gut-acting antibiotics. In case of neonates and enteritis, sulfa-trimethoprim is very commonly 15 to 30 mg per kg body weight. Penicillins are very commonly used in case of gram-positive infections like listeriosis. We are very commonly used in case of penicillin, listeriosis, tetanus. All these conditions we are commonly using penicillins. And tylosin, you might have heard about tylosin. It is very effective for mycoplasma, 10 mg per kg body weight. It's very effective for contagious caprine pleuropneumonia. So all these antibiotics are commonly used in case of small ruminants. So don't use these antibiotics indiscriminately. Use whenever that is a relevant use. Relevant antibiotics, specific antibiotic for specific conditions. Okay, that will be giving the good results rather than going for rather than going for indiscriminate use of antibiotics. So for specific conditions, for example, it is a tetanus, you use penicillin. Listeriosis, you can use penicillin or OTC. That will be very specific and very easy to treat. Regarding the anthelmintic, so many number of anthelmintics are available for the deworming sheep and goat, and there are different type of protocols are available, and some practitioners or some farming conditions they used to say there is no need of having a regular deworming, and sometimes they will be having a regular deworming schedule. So mostly if it is a farming sector, you can go for the evaluation of dung sample evaluation, and you can evaluate the what is the nature of the infection, endo parasitic infection, and you can go for the accordingly deworming. You can select it, and it will be more efficacy. And also, don't use the same deworming drug repeatedly in the same flock, so that resistance will be formed. And there are so many other protocols are there. I'm not going in depth of the deworming schedule. Just to have awareness regarding the deworming, they are putting the dose and components for your awareness. Okay. So ivermectin is commonly used as a deworming in sheep and goat at 200 microgram per kg body weight. It can be used subcutaneous or perorally. Okay, albendazole 7.5 milligram per kg body weight, and fenbendazole is also very commonly used as 5 mg per kg body weight. And oxybendazole, bebendazole, levamisole, these are all very commonly used in case of sheep. You use these drugs, deworming anthelmintics, as a rational whenever it is needed according to the specific conditions. So in goat also the same thing, albendazole, fenbendazole, levamisole, ivermectin are commonly used in case of goat. When you compare with the sheep and goat, the dose may vary in goat. So because the goat requires higher dosage than the sheep. So homoncus is very common in sheep and goat. So whenever you come across a case of anemia in sheep and goat, blanched mucous membrane, sudden anemia, mortality is there. So your first differential diagnosis is homoncus. So as we have seen the first slide, the mucous membrane will be edematous in nature. The anemia, pale mucous membrane with the edematous in nature, it is indicative of hypoproteinemia with anemia. You have to think about endoparasitic infection, that too homoncus. So whenever there is a mortality, doing the postmortem, just to see the abomasum. In the abomasum, you can able to see the numerous small reddish barber's pole, that is a red stomach worm. Homoncus will be noticed. Once you diagnose it, you can treat it all the animals with ivermectin. Very good effective treatment will be there, and you can control the mortality. Okay, you can control the mortality very easily when you diagnose it promptly. So in fasciola, when you regarding the fasciola conditions is very common in some areas in sheep. So you can use the triclabendazole 10 mg per kg body weight, or albendazole 7.5 mg per kg body weight, or closulan, nitroxinil, oxyclosinate, closental. All these things drugs can be used in case of fasciola. According to our practice, your experience in that area, you can select these conditions, any type of anthelmintics, and you can use it effectively. So in goats, they metabolize some anthelmintics more rapidly than the sheep. So the goats require more dose than the sheep. That is the reason. So always, whenever you're going for the deworming in a flock or in a farm, a judicial use of anthelmintics should be there, and the regular deworming schedule should be followed. And the selection of anthelmintic is according to the nature of the endoparasitic infection, and correct dosage should be administered, and correct route of administration. Whenever you go for underdose, the efficacy will be reduced, and there will be resistance will be formed. So this is a picture just for your awareness I put. It's not a specific condition. Whenever the animal, when you are experiencing some animal, when they are hitting the head in any object or in a wall, it shows it's a hypoxia. So immediately you can say this type of animal are anemic. So when you see the mucous membrane, the mucous membrane will be blanched or pale in nature. So just for highlighting, I have put this picture. So this is ammonia. So when you come across this type of segments coming in the dung material, so it's a clear case of monesia. Okay. So the normal dung material in a sheep and goat is a conical in shape. Whenever you come across the dung material as a pasty, it is a clear case of diarrhea. That you need not expect watery or semi-solid diarrhea, I mean dung material in sheep and goat as a diarrhea. When it is a pasty in nature, when it is not in pellety, then you can assume it is a diarrhea. It's abnormal dung. Okay. So this is a monocia. So monocia segments. So as already told, you can treat it for tapeworms. This is also a monocia. Praziquantel, you can go for any treatment with the praziquantel combinations. Fenbendazole with praziquantel combinations. So in this picture, you can able to see larva in the nostrils. So it's a very common in sheep, and also occasionally noticed in the goat also. The farmers, they used to say the animal is frequently sneezing. The animal is frequently sneezing, and occasional bleeding from the nostrils occurs. So you have to go for the differential diagnosis of Easter ovis. Okay. So larva coming out of the nostrils, and you can treat it well with the ivermectin. So this type of cases very well respond to the ivermectin. So another condition is enteritis. It's a very common in small ruminants. It will be you will be feeling difficult to control this type of cases. Enteritis. The farmers will be daily coming to our hospital and telling you the animal is having diarrhea, not under control, and daily you will be telling, and you will be under frustrated to treat this type of enteritis case, especially in the young ones. So when diarrhea is there, enteritis is there in adult one, the first differential diagnosis is acidosis. So you keep it in mind. Diarrhea in adult one, adult sheep or goat, first rule out ruminal acidosis. Then you go for the parasitic, any other parasitic infestation is there or not. Then you think about the infectious origin like PPR. So these three things you have to keep it in mind in adult one. So ruminal acidosis, you can very easily appreciate that in coming slides. I will be telling you the fluid splashing sound in the rumen. You can able to appreciate the fluid splashing sound, and the diarrhea will be noticed. The animal will be dull and depressed. Okay. In PPR, the animal will be having oral lesions will be there with the diarrhea, respiratory involvement. And in endoparasitic, you can evaluate by doing the dung sample evaluation. So you can easily classify what is the nature of the diarrhea and treat it accordingly, rather than treating symptomatic. But in young one, enteritis is very common due to the parasitic infestation or bacterial, mainly due to bacterial infestation, or sometimes due to milk overload, and in some grown animals like 2-month, 3-month old, maybe due to acidosis also. So you have to differentiate all these things by clinical examinations. So when they are bringing the animal to you, you have to see the hind quarter, the perineum. You have to see the perineum, how much of dung is smudged in the tail and the perineum region, so that you can evaluate the scoring. You can evaluate the nature of the diarrhea. The animal will be debilitated, dehydrated. So animal having a diarrhea. So they will bring the animal to you for the treatment. So you have to explain to the farmers that it won't be get corrected within a single day. It will take a course. This type of enteritis due to bacterial infection, it will take a course. The neonatal infection or neonatal diarrhea due to E. coli or any other bacterial infection, it will go for a course, and it will be getting improved in a week, 5 to 7 days. That you have to tell and make awareness to the farmers. Then you can treat it accordingly. See, the animal will be dull and depressed, and that the mental status will be varied. The dehydration will be noticed, and you have to treat it accordingly. See, this is called a DAX score. So this will be very much applicable when you are going for a farming consultancy. So see the score. The perineum is matched with the dung material. So score 1, there is no dung material at all. It's okay. Here the only the under the trail and the under the perineum, the dung material is available. Here the thigh regions are smudged with dung. It's under score 3. It's severe means score 4, and very severe conditions means score 5. So when you are going to the farm, just by seeing the kids from the distance, the kids and the lambs will be running here and there or standing there, just by seeing the perineum, you can appreciate the DAX score. The management of the farm, you can appreciate within a few minutes. If it is a score of 5, you can easily say the feeding pattern is not good in that farm. Maybe a parasitic infection, maybe a predominant and bacterial infection may be more common in that farm. Segregation of neonates will be more in that farm, so that you can identify all these conditions. You can treat it accordingly. So this is called DAX score. So treat it accordingly. Whenever this you come across the case of enteritis, the first line of treatment is, rather than giving antibiotics, you go for the fluid therapy. So you can give ringer lactate. If it is very well dehydrated, you can go for intravenous infusion of ringer lactate. If the animal is having suckling reflex, you can go for oral fluid therapy. As already told, you can supplement electrol powder in water and you can give oral rehydration therapy can be given. And antibiotics, if you suspect for a bacterial infection, you can go for antibiotics like sulfa-trimethoprim can be given, sulfa-dimidine can be given, amoxicillin can be given, so that you can able to control. And if you come across any endotoxemic shock like thing, you can go for flunixin 1.1 milligram. One dose can be sufficient. 1 day or 2 days can be given. Don't give atropine sulfate to control diarrhea. It is not a advisable treatment. So you should not use any atropine sulfate or no loperamide in case of treating enteritis. And milk, some practitioners they used to say milk can be restricted. Not like that. Milk can be given even in case of diarrhea cases. And you need not to starve the animal. You can feed or you can give them milk for the animals. No need of starvation and all. The best thing is fluid therapy. When you give fluids, the animal will recover within few days. And regarding the coccidiosis, the diarrhea, the differential diagnosis, other differential diagnosis, you have to keep it in mind of a coccidiosis also in the neonates, the young one or adult one also. So the clinical cases, whenever all these cases, you have to think about the diarrhea cases. Mean naturally the differential diagnosis should come in coccidiosis also. So the animal will be very much emaciated, diarrhea will be there, and the weight loss will be there, and the young ones are more susceptible. Okay. So regarding the treatment, you can give sulfa-dimidine, you can give orally 135 milligram, 130 milligram per kg body weight orally, or sulfa-guanidine tablets or bolus are available that you can give 200 to 250 milligram per kg body weight, and sulfa-timethoxin, any sulfa components can be used. Sulfa-trimethoprim injections also can be used. At 15 to 30 milligram per kg body weight, you can give either subcutaneous or you can give intravenous also that you can give. Sulfonamides will be a best one for controlling coccidiosis. And sometimes you may be using this amprolium for when there is a more number of cases in the farm. You can go for amprolium in drinking water or the feed. You can give it in the supplement in the feed for the sheep and goats. Okay, 100 mg per kg body weight for goats for 4 days can be given. So whenever you are giving amprolium, you follow the proper dosage. Otherwise, excess dosage will lead to neurological signs of vitamin B1 deficiency. Okay, that you have to take care. You can use some other myanophore antibodies like monensin can be added in the feed if they have a large number of cases in the farm. Lactol acid is a component that you can use at 20 to 30 gram per ton of feed can be mixed and you give it. When you are coming across, these are all for farming conditions. As an outbreak, when you come across a more number of cases in your farm, you can mix these components in the feed and you can supplement. Individual cases, you can very well treat it with the sulfa-trimethoprim, 15 to 30 milligram per kg body weight, so that the animal will become normal, recover well. So whenever there is a outbreak of abortion also in a farm, you have to think about the coccidiosis outbreak. Coccidiosis, one of the main differential diagnosis of storming abortion, you have to think about coccidiosis. And another one clinical condition is called pneumonia. So pneumonia is very common in the neonates, and also aspiration pneumonia is whenever they are feeding some syrup or liquid preparations or medications, the owners they will get aspirated. So they will bring that animal and they will be treating for aspiration pneumonia. And the other clinical condition of the young one, as many veterinarians they used to say, the young neonates, 1 month old or 2 weeks old, 3 weeks old animals, small lambs, kids, and even calf also you'll be getting calf pneumonia. Neonatal pneumonia is very common. The animal will be having temperature, respiratory distress will be there, oral respiration will be there. When you auscultate the lungs, severe exaggerated lung sounds will be there. So these are all the classical signs of pneumonia. The animal will be panting, severe panting. The respiration rate will be more than 20 or more than 40. So you think about pneumonia in case of young ones. In such cases, you can go for antibiotic treatment. So in case of pneumonia, don't go for fluid therapy. So it may lead to pulmonary edema and the animal will collapse. So avoid fluid therapy, and better you can go for parenteral antibiotic treatment like ceftiofur can be given 1.1 milligram per kg body weight. Either you can give intramuscularly, amoxicillin can be given. Ceftiofur will be the effective one. You can give furosemide when you have during the auscultation, when you can able to appreciate the pulmonary edema, you can go for furosemide 2 to 4 milligram per kg body weight intramuscular. Flunixin, you have to give flunixin 1.1 milligram per kg body weight. So in pneumonia cases, we used to say AFF, antibiotic, furosemide, flunixin. It's a combination to have a very good clinical recovery. In some cases, you can even go for deriphyllin injections. When there is a aspiration pneumonia, you can go for deriphyllin injections are available. That means bronchodilators, any type of bronchodilators can be given by injections. And you can also use nebulizers. Okay, nebulizers are very commonly used in case of small animals like dog and cat. We are using, the human being also we are using. The same nebulizer can be used in case of calf, sheep, and goat also. So these are the nebulizers which are commercially available in the medical shops, so that you can use well for treating this type of pneumonia cases. So here you can put the medications. You can put the medication and you can keep the in the nostril, and you can go for the inhalations. So you can go for a safety for it. What are the medications you can give? You can put the budesonide. It's a corticosteroid that you can add, and you can gas a nebulizer. You can add budesonide. You can add salbutamol. You can add gentamicin. You can add this safety for anything according to the clinical conditions. You can add and give as nebulizers. See, this is a nebulizer, and you have add a budesonide, and you can give nebulizers. So dramatic improvement will be noticed. So it can be tried in case of aspiration pneumonia or neonatal pneumonia. Due to bacterial pneumonia, it will be very much useful. See, this type of nebulizers can be used. So here you can add the budesonide or ceftriaxone or gentamicin, and you can give the nebulizers. So very effective. Apart from the parenteral treatment, you can also give this. Okay. So the next thing is the gangrenous mastitis. You may be coming across this type of cases very commonly in the field conditions. The owner used to say immediately after kidding. So the history is very clear. Recently kidded animal. Okay. So the animal, they used to say over 10 days back or 2 weeks back, the animal kidded. So the udder becomes swollen. The milk discoloration is there, and you will be examining the udder. So the udder will be very much hot in nature, and you will be treating accordingly. After 1 or 2 days, there will be discoloration of the udder, and the milk secretion, the color will be changing. Sometimes it may be watery in nature, or sometimes it may be serosanguinous in nature, and discoloration will be there. The udder will turn blue color in nature, and it will go for gangrenous mastitis. At last, what they will say, the owner will say, when first day it was very hot only, later it developed discoloration and it is slough off, then they will blame you. So because you have to make the awareness to the farmers that it is a case of gangrenous mastitis. Whenever you come across a mastitis in a recently kidded animal, it is due to Staphylococcus aureus, otherwise called as blue bag disease or gangrenous mastitis. So you have to, the first day when you are examining the animal, the udder will be very hot and swollen, very hard in nature. So you have to anticipate gangrenous mastitis in the few days. So you have to educate them. Okay. In few days, there may be discoloration in nature. The udder, when you palpate the udder, it will be cold on nature. The first day, it will be hot on nature. In the subsequent days, when there is discoloration or bluish discoloration, when you palpate the udder, it will be cold on nature. Serosanguinous fluid will be there, discharge will be there. Sometimes the fluid will be oozing out from the udder. These type of cases won't respond to the treatment, and the prognosis will be poor in such a type of cases, gangrenous mastitis. Okay. So only see the discoloration of the udder, bluish in nature, and when you palpate the udder, it is cold in nature. So it indicates gangrenous mastitis. Already gangrenous has been set off and discoloration has been formed, and you cannot treat it, and you cannot bring back the udder back to the normal. Only the thing, you can prevent the septicemia, and you can save the animal by giving fluid therapy, by giving broad spectrum antibiotics and flunixin intravenously. You can save the life of the animal, but we cannot treat it the udder. You cannot bring back the udder to the normal. So that you have to take care in telling the prognosis. See, this type of gangrenous mastitis, the udder will become peel off, and it will slough off in few days due to Staphylococcus aureus. That you have to be very cautious. So whenever you come across mastitis in the recently kidded animal, you treat it intensively, vigorously. You treat it vigorously with antibiotic fluids, so that you can save some of that. Sometimes you may be coming across a nascent in sheep, mostly Staphylococcus aureus, 80% of the cases are due to Staphylococcus aureus, and other organisms like Manemia hemolytica and Staphylococcus echinacea and E. coli are very common in case of sheep. And sometimes you may be coming across the contagious echinacea, maybe mycoplasma, due to mycoplasma. So whenever you are coming across the three classical clinical signs, we used to say as a three classical clinical signs: mastitis, arthritis, keratitis. Any combination of these three things, you suspect mycoplasma. Simple logic. Mastitis will be there in some flock. I mean, the flock, some animals will be having mastitis, some animals will be having arthritis, some animals will be having keratitis. Or the same animal will be having three signs. You think about contagious alexia due to mycoplasma alexia. So you have to treat it with the tylosin. So this such a type of animals will respond to enterofloxacin and tylosin combination. Otherwise, it won't respond to the treatment. Tylosin can be given at the 10 milligram per kg body weight. Okay. And the enterotoxemia, it's very, you may be coming across this when in the field conditions. The farmers used to say that I'm not going in deep of enterotoxemia cases. It's a very big topic, and even it may take 1 hour to come across this handling this type of enterotoxemia class. So just for awareness, I'm putting there are different types of enterotoxemia like type B, C, and E. Type B, lamb dysentery, is due to Clostridium perfringens. Type B, lamb dysentery, and type C is occurring in young lambs. Okay, type C. And goat enterotoxemia is also associated with Clostridium perfringens type C. Okay, mostly. And many of them, the farmers, they will be telling in the flock, whenever they are going for grazing and coming back from the grazing, sudden mortality. They used to notice the sheep or lamb due to the overfeeding. It's mostly commonly seen in overfeeding animals, and suddenly the animal will jump and it will lie down and it will die. So that is a classical sign of enterotoxemia. So the farmers sometimes they will notice and they will tell. Sometimes you may be presented as this type of clinical cases to the hospital. The animal will be showing convulsions and the grinding of the teeth, severe grinding of the teeth, and convulsions will be noticed. This is also enterotoxemia. The animal will be exhibiting diarrhea will be there. Whenever you are connecting the fluids and you are start the treatment, the animal will die. So this is also enterotoxemia. Sudden mortality also we have to think about enterotoxemia. Okay. So to prevent that, you have to go for vaccination. ET vaccination is available. Enterotoxemia vaccination should be done to prevent this type of cases. And regarding the bacterial, the another case is very commonly we are coming across the tetanus in small ruminants. So why we are coming across the tetanus in small ruminants? Because as I already told, some cases when you are not carrying the umbilical care is not done properly in the neonates, either it may go for a joint ill or navel ill. Otherwise, because of the contamination of Clostridium organism through the umbilicus, it may go for tetanus also. Okay. And the animal will be having a sawhorse appearance, and erect all the forelimbs and hind limbs will be rigid, and the erected ears will be there, and the tail will be elevated, and the animal will be looking like a toy-like appearance or a sawhorse appearance. Locked jaw will be appreciated. So once the locked jaw is and the rigidity of the limb is there, the treatment it won't respond to the treatment. So you have to tell the owners if it is presented earlier in sheep and goat, the response will be okay. Somewhat the animal will respond to the treatment. When the rigidity of the limb is noticed and locked jaw is noticed, it won't respond to the treatment. See, this is the earliest stage when the animal is walking with the hind limb rigidity and elevated tail. See the gait. The hind limb rigidity is noticed and the animal is walking like a toy. So in such a type of cases, when you start the treatment, the animal will respond to the treatment. When the animal is presented with the rigidity of the forelimb and the hind limb with the locked jaw, mostly it won't respond to the treatment. See. So this is the advanced officer tonus, locked jaw, and forelimb and hind limb is there. This type of animal won't respond to the treatment. When it is presented, it will respond to the treatment. See the response is a advanced stage of tetanus. So treatment, you can treat it with a large dose of penicillin, and you can use in the neonates. You can use one thing. You can use a large dose of penicillin, or otherwise you can use a combination of amoxicillin with the metronidazole. Metronidazole can be given IV. Amoxicillin as intramuscular. That combination also can be given, or otherwise you can go for large dose of penicillin, and diazepam can be used for the muscle relaxants. Okay. Even you can use a 10% magnesium sulfate as a subcutaneous for muscle relaxants. So prevention, you can go for a tetanus toxoid at 2 doses at interval 3 weeks. TT injections can be given, and the immunity will be there. And another one condition, just for awareness, I'm telling, I'm not going as nowadays. Already it's 1 hour, so then I'm going a little bit fast. So contagious capillary pneumonia is very common in sheep and goat in field conditions. Whenever you come across a severe nasal discharge and respiratory signs, severe respiratory signs, not responding to a routine treatment, severe productive and violent cough, and mortality will be more in that flock. So you always think about contagious capillary pneumonia. Sometimes the head will be edematous, jowl edema will be noticed, and the extended neck and the extended forelimb also noticed, reluctant to move. In all these things, you have to think about contagious capillary pneumonia. So in a farming condition, when there are more number of animals, many number of animals showing respiratory signs, and there is any mortality, just you can able to appreciate when doing the postmortem, you can able to appreciate the fluid presence, serosanguinous presence of fluid in the thorax. Presence of serosanguinous fluid in the thorax is a clear case of contagious capillary pneumonia, or otherwise the presence of cheesy lungs. So it's a classical sign of contagious capillary pneumonia. So these type of animals will respond very well to tylosin. You can give the injections of tylosin, 10 milligram per kg body weight, intramuscular for 7 days, 7 to 10 days, so that the animal will recover normally. In that flock, you can prevent further mortality. Okay. The another one important clinical condition is a polioencephalomalacia. So when I used to remember that when I came to Bangladesh, our Chittagong University Hospital, I have seen many number of cases during my stay that for 10 days, and polioencephalomalacia. So I got a very good feedback from the field veterinarians, and they are treating well of the polioencephalomalacia, and treating diagnosing the case in the earliest stage itself. So this otherwise called as cerebrocortical necrosis. It's also called as goat polio. It's very common in cattle, sheep, and goats due to thiamine deficiency. So why it occurs thiamine deficiency? It's because of the altered rumen microflora. When you are feeding with excess carbohydrate and low roughages, there will be imbalance between the carbohydrate and the roughages. That will lead to multiplication of one bacteria called as Bacillus thyminolyticus in rumen. So this Bacillus thyminolyticus in the rumen, they will proliferate, and they will block the synthesis of thymine, and that will lead to thiamine deficiency. Once the thiamine deficiency occurs, the animal will start showing neurological signs. This is the condition called polioencephalomalacia. The other causes are when there is excess sulfur in the diet. Number one, excess sulfur in the diet. When you add more amprolium, as I already told, excess amprolium when you are treating coccidiosis, or when you are giving excess amprolium, that also will lead to polioencephalomalacia. When the animals are fed with the wet distilleries grain, a high molasses urea diet is associated with the altered thiamine status. These are all the etiological factors for polioencephalomalacia. See, the cases which are presented with nystagmus, either it may be a vertical nystagmus or horizontal nystagmus, you have to think about polioencephalomalacia, thiamine deficiency. See, these guys, we can able to appreciate the classical nystagmus. Nystagmus means movement of the animal, whether it may be a vertical nystagmus or a horizontal nystagmus. The animal cannot be able to stand normally. So in the earliest stage itself, you can identify the clinical case. The farmers, they used to say, the animal is not able to walk properly. It is segregating from the flock. It will go and get hit in the wall. It will get the support of the wall. It won't walk properly. It will go and get the support of the wall, and a staggering gait will be there. Incoordination will be there. When you touch the animal, suddenly the animal will fall down. Nystagmus will be noticed. In the later stage, the animal will go for lepromancy. Even you can identify at the earliest stages. When the animal is having incoordination, that time itself, if you are starting the treatment with the timing, the animal will very well respond to the treatment. So this animal is recommend. See, you can able to appreciate the nystagmus. Classical nystagmus is noticed. So this is another one case of nystagmus. So this nystagmus with the lateral recumbency is indicative of delayed case, delayed presentation, more than 2 days or 3 days. It is like that. So earliest presentation will the animal will be having incoordination, and the animal cannot able to walk properly. Staggering gait will be there. Wide base of hind limb will be there. That is a classical wide base of hind limb will be there. And when you make the animal walk, it will walk with a staggering gait. That time itself, if you are starting the treatment with the thiamine, it will respond well to the treatment. So this also the lateral, the animal is present with the lateral recumbency, pedaling will be there. So this type of animal, there are all the vital signs will be there. Another classical signs, when you make the animal rotate, this is the classical sign. When you make the animal to rotate to one side, it will try to get back to the another same side. It won't lie in the same side. When you rotate it in the one side, you try to come back to the other side. That is also one of the classical signs of polyencephalomalacia. See, the animal, when you put to one side, it is normally it is lying down. When you turn to one side, other side, the animal will try to get back. So this is one type of this. You can do it clinically and you can evaluate. So delayed cases, it will be like this, and you have to treat it accordingly. The response to treatment depending upon the individual cases and the day of presentation. When it is presented earlier, response will be good. Okay. So here the dung material will be normal in nature, normal in consistency. Vital signs will be normal. Temperature, pulse rate, heart rate, everything will be normal. Even if you give some leaves and all, sometimes some animals they will take feed and all. Feeding habit may be normal to inhabitants. It depends upon the individual animals. See, when you put the animal to other side, roll back to, when you turn back the other side, it will try to roll back to the other side. It's called polyencephalomalacia. So differential diagnosis: cerebrospinal pneumothoracisis, caprine viral arthritis, encephalitis, and senurosis. And Kumri, there will be progressive hind limb paralysis will be there. Not the other neurological signs won't be there. In Kumri means cerebrospinal pneumothoracisis, only the hind limb paralysis will be there. And senurosis, only the animal will be having mental status will be altered. The animal will be having dull and depressed mental status. So treat the case with the thiamine 10 mg per kg body weight, intramuscular or intravenous. And whenever you are giving a B complex injection intravenously, always mix it with the fluid and give intravenously. Okay, don't give the B complex injection direct IV. At the same time, don't give any B complex injection which is having the liver extract IV as a IV. Okay, it will lead to anaphylactic shock. So whenever you are giving a liver extract with the thiamine preparation, give intramuscular. Whenever you are giving a thiamine IV, you have to mix it with the fluids and give IV. Otherwise, you can give intramuscular. So usually it is given as a 10 mg per kg body weight every 4 hours. Every 6 hours. But since it is not practically possible, we can give as a 40 mg per kg body. That you can give no problem. You can give thiamine 40 milligram per kg body weight, either intramuscular or intravenously, for 2 to 3 days. Excellent results will be there. That will become normal. Other supportive treatment can be given. If you need it, you can give mannitol intravenously intravenously, and you can give dextrose solution for energy purpose, and you can give dexamethasone intramuscular. Okay. The main treatment is thiamine supplementation. I think the time is running up. Let me go fast for a few cases. And this is a hypocalcemia in EU. Whenever a sheep or a goat with a full-term pregnancy is presented to you with the coma stage, you just rule out ruminal acidosis and hypocalcemia. How to differentiate ruminal acidosis and hypocalcemia? See here, the fluid splashing sound. Just to see the fluid splashing sound, whether there is any fluid splashing sound. If it is having fluid splashing sound, the animal is in acidosis. See the dung, if it is semi-solid in nature, it is acidosis. Otherwise, if the dung is normal in consistency, pellety in nature, no fluid splashing sound, the pupil is very much dilated, the animal is in lateral recumbency or cell recumbency or coma stage, think about hypocalcemia. Usually hypocalcemia in cow occurs immediately after calving. I think immediately after calving means within few days after calving. within 72 hours or within 1 or 2 days after coughing in cow. But in ewes or in sheep and goat, hypocalcemia is noticed in the full-term pregnant, that too in the advanced pregnancy it is noticed. So you should not miss this type of cases. See, the dung material will be noticed in the rectum and it will be intact. And also the rectal mucosa will be slightly relaxed. The animal is not passed urine, no fluid splashing sound, pupil will be dilated, the animal will be in the coma stage. All these are classical signs of hypocalcemia in ewes. So the animal will very well respond to calcium injections. You can give calcium borogluconate slow intravenously. Just you can give 50 ml intravenously. You can give immediately. The animal will respond to the treatment. Urination will be there. The animal will become normal. Only the thing, recurrent hypocalcemia is very common in sheep and goat. So you have to treat it accordingly at 8 hours interval. So the main etiology is due to stress factors, because the advanced pregnancy, because of the stress factor, the inclement weather condition, hypocalcemia occurs very common in sheep and goat. So identification of these cases is very, very important in case of farm practice. So this is a case of listeriosis. So differential diagnosis, the menace reflex is absent in this case. The droopiness of the ear is noticed. See, the partial closure of the lips. The lips is not closed properly. The menace reflex is absent in this side. Droopiness of the ear is noticed in one side. There is a facial paralysis occur and partial opening of the mouth is noticed. It's a classical case of listeriosis. Okay. So facial paralysis may occur. Some cases circling will be there. The animal will be going on, circling will be there. So this is a classical case of listeriosis. It will very well respond to oxytetracycline or streptopenicillin can be given. So either you can go for oxytetracycline intravenously or penicillin injections can be given along with the thiamine injections, vitamin B1 supplementation for a week, so that the animal will respond well and the recovery is according to the individual cases. Okay, earliest presentation, recovery will be very nice. Some animals that are having the chewing ability will be lost, and when you give any fodder or anything, it will be going on chewing. It won't get intake. So because of the facial paralysis, it will drop it out. Some owners, they will bring the animal as a presence of cut material in the oral cavity. The presence of cut material in the oral cavity, retention of the cut material in the oral cavity, absence of venous reflex is also a classical sign of listeriosis that you have to take in care according to the individual cases by clinical examination. See, the droopiness of the ear is noticed, ptosis of the eyes noticed, unable to chew the fodder. When you leave the animal will be going on circling in nature. All these signs are classical signs of listeriosis. So animal will respond to penicillin injections or oxytetracycline. See, the menace reflex is absent. Droopiness of the ears are noticed. So you can see all the menace reflex in all the cases. You can evaluate and you can easily diagnose this type of this listeriosis. So I'm not going in depth of acidosis. Only if time available with the permission, I will take later on this. Just we will show some pictures of viral diseases. In PPR, you can able to appreciate the oral lesions in the gum region. That you have to keep it in mind. Pestitis petis ruminans, PPR, you can able to appreciate the oral lesions in the gum. Why I'm insisting, many of the veterinarians, they get confused from PPR and the other clinical conditions. So brand-like lesions in the gum or tongue, not in the mucocutaneous junction. In the gum region or in the tongue, brand-like lesions is an indicator of PPR. So when the animal is having respiratory distress, brand-like lesions in the oral cavity, diarrhea, you think about PPR. Respiratory involvement, diarrhea, and oral lesions. So classical signs of PPR. Nasal discharge, oral lesions, diarrhea, you think about PPR. See the brand-like lesions in the oral cavity and the gums. And the other classical signs, the ocular discharge, bilateral ocular discharge, crust-like ocular discharge, crust-like lesions or crusts around the eyes. Ocular discharge will be noticed, and the crust-like lesions is a classical signs of PPR. You cannot miss this type of cases. Crusts will be noticed in the bilateral ocular lesions. Ocular discharge will be noticed. oral lesions will be noticed, nasal discharge will be there, and diarrhea will be there. See, the nasal discharge with ocular discharge. Here, this is the mucocutaneous junction. There is no lesions in the gum or the tongue, but the lesions are present in the mucocutaneous junction. See, scab-like lesions. They are brand-like lesions. Here, scab-like lesions in the mucocutaneous junctions is a classical sign of ORF, otherwise called as contagious ecthyma. It's also a viral disease. It's called as ORF or contagious ecthyma. See, scab-like lesions in the mucocutaneous junction. So it will be there for a week, 1 or 2 weeks. So the treatment includes symptomatic treatment. Symptomatic treatment for ORF, either you can go for antibiotic treatment, anti-inflammatory, external application with a antibiotic ointment, or you can apply turmeric with neem leaves. You can make it as a paste and you can apply over the lesions. See, so ORF, scab-like lesions noticed in the mucocutaneous junction, then the young ones in the gums, like the cauliflower-like lesions. So whenever you are coming across the lesions like this, small erythematous lesions underneath of the tail or in the perineum, you have to think about sheeppox. In sheep, whenever you are coming across a erythematous small lesions under the tail region or in the perineum region, you think about sheeppox. See, small lesions, erythematous lesions underneath the tail and the perineum, and you can able to appreciate the small elevated circular-like lesions in the ear and also in the neck region and in the facial region, neck region and in the ear. It's a clear case of sheeppox. You have to think about sheeppox. Respiratory involvement, mortality, lesions underneath the perineum, underneath the tail region, elevated circular lesions in the ear. Think about sheeppox. See, small eruptions noticed all over the body region. It's a classical case of sheeppox. And the blue tongue, you may be appreciating the lesions in the tongue and also in the coronary region. So some veterinarians, you would have come across this type of cases, edematous and protrusion of the conjunctiva. This is called a case of called chemosis. This is a condition called chemosis. It's due to some unknown plant toxicity or any allergens which is available in the plants. Any allergens which is available in the plant. Vital signs will be normal. Everything will be normal. Only the thing that will be having protrusion of the conjunctiva, either it may be unilateral or bilateral. It's due to some plant allergens. Just to give antihistamines. The treatment includes just to give antihistamines. It will be okay in few days. Some cases will respond well to antihistamines and steroids. You can give antihistamines, you can give steroids, and you can also give furosemide, 2 to 4 milligram per kg body weight, as opposed to 2 to 3 days, then will become normal. If it is having erosions, you can go for antibiotic ointment. Eye ointment can be applied. And according to the cases, you decide it and you can treat it accordingly. Sometimes we used to give subconjunctival injections also by use of insulin syringe. We used to give these placentrix injections or steroid, dexamethasone subconjunctivally. That will also respond well. So the treatment, the options depend upon the clinicians. So very good response will be noticed. This is also another case of we used to call it as angioedema. So here you can able to appreciate the swelling of the ears like a spongy in nature. See the chemosis, edematous eyelids are noticed, and you can able to see the spongy ears. This is also angioneurotic edema. This is we used to call it as angioneurotic edema due to some plant allergens. It will respond well to antihistamines and diuretics. It's very common when the animals go and come back from the grazing. Okay. So another one condition is called the pink eye. So in large animal, in sheep and it's very common in sheep and goat. One, if you are able to see the one animal in your flock, you can anticipate many number of infections in the flock. So the owner says many number of animals, like 10 animals, 20 animals in the flock, daily 1 or 2 animals and new cases are coming like that. They used to say this. Otherwise called as infectious keratoconjunctivitis, pink eye. In cow, it's due to Moraxella bovis. You might have heard about Moraxella bovis. It is very common in cattle. In sheep and goat, it is due to chlamydia. It's very commonly due to chlamydia and also due to mycoplasma infection. So this type of infection is very common in sheep and goat. It comes as an outbreak. So you can treat it very well with the enterofloxacin. You can treat it with the enterofloxacin and tylosin combination. Enterofloxacin and tylosin. Enterofloxacin 5 mg per kg body weight or tylosin 10 milligram per kg body weight. And you can give eye ointment, can be any antibiotic eye ointment, oxytetracycline eye ointment, chloramphenicol eye ointment, or any other ciprofloxacin eye ointment can be administered, and the animals, all the animals, they will respond well in 1 week. Okay, these are all the opticaps. As eye ointment, opticaps are available that you can use apart from the injections. So with this I conclude, because of this time availability, so I have not covered the acidosis case, that we can see it in another session separately. So because of the time factor, I have not included the acidosis case. Thank you very much. Yes, Deliver.
There's some sound. Bernard?
The questions,
Thank
there
you,
are some
sir, for your
questions. Yeah.
my intern.
How long we should continue the treatment for floppy kid syndrome? So we have to continue the treatment till the animal get recovers. So in floppy kid syndrome, they used to bring the animal in the lateral recurrence. You are diagnosing the case as a floppy kid syndrome by clinical examination. The abdomen is distended, cold extremities, animal is in the coma stage, and you are giving a sodium bicarbonate injection, 1 ml per kg body weight, and you are giving fluid therapy, lactate. And the next day they are bringing, the animal is getting improved, and till the animal gets improved, you continue the fluid therapy. The first day sodium bicarbonate is enough. The consecutive days you can give the fluid therapy, ringer lactate with the supplements alone, that is enough. Is the watery mouth is only limited to? Yes, it is limited to the neonates only, that to day old or within 1 week old, within 1 week. That is the peculiarity. You cannot expect that watery mouth condition in 1 month old or 2 month old, like that. It's a neonate, that to within 1 week, that to 1 day old, 2 day old, like that. That's a peculiarity of watery mouth due to E. coli infection. Once you appreciate that case and you diagnose it and treat it, you will feel very happy. The response will be very nice. Yeah. So in case of goats, levamisole is said to be used cautiously. Why and how? So in a specific dose, we can use. I don't think any untoward reaction should be noticed in correct dosage. At the rate of 7.5 mg per kg body weight, it will be okay. At 2.5 mg per kg body weight, it will be act as a immunostimulant. When should apply doramectin intramuscular? If the availability of doramectin is there, you can use it for mange as an alternative of ivermectin. You can use doramectin, no problem, for sarcoptes, soraptes, and other things you can use. Instead of ivermectin, doramectin can be used in both. Yes, can use. Even for the homunculus, you can use. 。
Yes,
I'm sorry, my internet is
Yes,
just dropped
understood. Yes.
down. Uh, so this question answer session and the discussion. So at this moment, I'm just inviting Dr. Ahadujaman sir for his supplementary question or any opinion to Shivan sir's presentation. So Dr. Ahadujaman sir.
Thank you, Subramaniam sir, and thank you, Delwar, for giving me the space. Yes, it was a very nice and exciting presentation. Learned so many new things also, and also recap many other old things. I am just wondering about one question that sometime, although it is not very common, but sometime we get some patient just having issue with neonatal goiter, the swelling of the thyroid region just after birth. And this type of kid also his like familial history that sometimes their parents or the back which inseminate that had also the similar problem. So in that type of cases, sometimes we used like iodine spray in the perianal region as recommended, but in many other cases we cannot survive the patient. So is there any specific treatment like how can we handle this type of case effectively?
Yes. So the goiter, neonatal goiter, will be appreciated during the time of birth. Ill birth or stillbirth will be noticed with enlarged conditions in the throat region. So that we have
Yes,
to,
yes. I have this
yeah,
one picture
yeah,
like
yeah,
this.
yeah. Understand, understand. Yes.
Yeah.
Some will be having an outbreak like these things. So we have to evaluate the basic nutritional factors which are underlying factors which are making the availability of the iodine. Uh, we have to make sure in the farm conditions. So we have to go for the confirmation, and then we have to treat it accordingly. We have only the thing we can prevent. We can prevent in that farm conditions. We can prevent by earlier diagnosis. We can prevent. So we cannot
Okay.
treat it by iodine supplementation. We can prevent that.
Okay. Thank you. So Delwar, do I ask him any other questions that are in the chat box?
Yeah, let
Or
me.
Yes, sir. Yes, sir. You can ask a question, sir. If you have several questions,
How
you can ask. No problem, sir.
in Bangladesh, one very common case in goat is after pasteurization 2 to 3 hours later, some of the goats show the continuous breathing and crying with a loud voice. So you have to clinically examine. So if any feeding habit, everything normal, rumen consistency is normal, no diarrhea is there, continuous breathing, maybe you supplement timing. So timing supplementation can be given. Nothing else. What is the actual cause? Is it pain or other reasons? That you have to verify clinically, individual cases, whether it is due to pain or not. Otherwise, if everything is normal, you just supplement thiamine. I think it will respond to thiamine supplement.
So most of the case, we see that the goat are suffering the lateral dependency, and
Yeah, yeah, yeah.
she is crying
That's right.
continuously.
Yes,
It is
yes.
very
That's why I
complicated.
told you can try it with the thiamine supplementation. Thiamine. B complex, injections, you can try it. Whichever preparations which are having thiamine, you verify just each ml contains more than 50 milligram. Or each ml contains 100 milligram thiamine, which is a well and good. That is a well good. So whenever you are treating a case of polyencephalomalacia or this type of cases, when you are supplementing thiamine, you just verify the B complex injection. Each ml contains thiamine more than 50 milligram or 100 milligram like that. If it is containing 10 mg and all, the response will be very much poor. That we have to take care.
Yes, sir.
So, Rana, do you have any more question?
Is liver tonic is really beneficial before and after? Yes, you can give as a supportive. You can give liver tonics after deworming. You can supplement. It's a general one. No problem.
So mostly in these cases, we administered some painkiller, just like as fumicillin intravenously in these cases, or any
Which one?
steroid.
Steroids. Steroids.
Yes, sir. Any steroid
Uh,
we can suggest in this intravenous steroid.
you can see the condition. If it is a case of polyoencephalopathy, you can give steroids, no problem. Dexamethasone can be used.
Thank you, sir, for your nice answer.
Commonly
At this
used
moment,
in goat mastitis, we can go for broad spectrum. This one amoxicillin with the cloxacillin combination can be used. Enrofloxacin with the gentamicin combination can be used. Ceftriaxone can be used. Sometimes why we are using ceftriaxone and all, no, because to counteract septicemia. So that's why we go for such antibiotics. So enrofloxacin with the gentamicin or amoxicillin with the cloxacillin or ceftriaxone can be used.
so Rana, you have do you have any more question, Barman sir?
I'm typing whatever other questions. Just you can discuss other person. Now I'm typing other questions. Okay.
So actually, we have not included the portion of slides included of ruminal acidosis, because if I touch the ruminal acidosis, it will take half an hour. Then almost now itself it's 9 o'clock. Then it will go for 9:30. Then we will be having a separate session of ruminal acidosis separate later. Yes.
So another very common case in the field condition in Bangladesh that we very commonly see that most of the goats suffering from anemia, just acute anemia. The
Anemia.
conjunctiva are fully pale color, but at this case we try to treat with different hematogenic drug, just like as beginning with different kind of B complex and different kinds of vitamins. And there is no blood transfusion therapy available in Bangladesh. But most of the case, 2 to 3 days later, goat are die. But in this case, which strategy you can hold for the goat?
Yeah. That's why I included that presentation, the slide. I put that ectoparasites in the first as a clinical condition, because the most common part of anemia in small ruminants is the ectoparasites due to lice and flea. Then only the endoparasites. So anemia is a major factor for the economic loss in the small ruminants. So once you correct the anemia by etiological diagnosis and treatment, you can very well improve the economic. You can prevent the economic loss to the farming community. So when I had been to Bangladesh 2 years back, I heard that someone was doing some studies in blood transfusion. Someone has done, I think, blood transfusion studies in small ruminants. I heard that. So it is very easy to do the blood transfusion in small ruminants. After the etiological treatment, suppose if it is a lice infestation or flea infestation, treat it accordingly, and you can manage the extreme cases. Very pale mucous membrane and all, you can give the blood transfusion, you can save well the animal. Otherwise, you can give the supplements. You can give the supplements like B complex injections and oral B complex supplements can be given, and slowly you can revive back the animal normal to the conditions. Once you treat it accordingly, we can bring back to the animal. The PCV is very much less. I mean, below 15 or below 10, you can go for blood transfusion. You can standardize the blood transfusion small ruminants. Very easy one. You can collect it from the same farm. You can collect from the healthy animal. You can give it to the anemic animals.
So in this case, it is recommended to administer best to saline intravenously. It is correct or wrong the treatment for anemic
Yeah,
cases?
in anemia cases, you should not give fluid therapy. Saline or dextrose solutions, if you are giving, it will give to hemodilution, the animal will collapse. So in anemia cases, no need of fluid therapy, intravenous fluid therapy. In anemia cases, if the animal is dehydrated, you can go for oral rehydration. Oral rehydration is the best. Don't go for IV preparation, IV, intravenous fluids. Don't go.
Thank you, sir.
Thank you, sir. At this moment, I would like to invite Ridwan Pasha if you have any question or any matter of discussion with Dr. Shibarma. Pasha.
Thank you, sir. Thank you, sir. Thank you, Dalwar. Thank you, sir. It was fantastic presentation, I would say, because goat and sheep are most of, where to say, we do not focus so much. We cannot diagnose. They don't give so much time. So I have a couple of questions. First thing, the very first of your slides, you have said that most of the enemy cases is caused because of the ectoparasites. So do you recommend the ectoparasitic dips or insecticide dip of the goats or sheep routinely like the endoparasitic prophylaxis? Do you recommend it?
Yes, of course. The routine screening. First, you have to go for the screening of ectoparasites, whether it's the presence of lice or flea or ticks. These three things you have to rule out: lice, flea, ticks. Lice, as already told, you can screen it, and flea also you can. So if you are going and as a consultant in a farm, you just screen it and see it under a low power microscope in the microscope and verify lice or flea, and you can tell them clearly, and accordingly you can go for the dipping. So you can go for dipping, and you can train the farmers for dipping. Okay, with the ectoparasites. That is one important thing. You have to educate the farmers and you have to train the farmers for dipping for ectoparasites so that we can prevent the economic loss. That is the main thing we have to concentrate, ectoparasites. And the same thing, ticks, tick infestation. So once tick infestation is there, definitely we will anticipate red protozoal diseases like anaplasma, filaria, babesiosis, everything will be there. So once it is controlled, everything will be okay.
Okay, sir. So I have another question is, can you use mebendazole, as you have stated in your slide, is effective as to use as prophylaxis for endoparasites, mebendazole?
Mebendazole. Yeah, it's
Yes, sir.
according to yes. See, according to the specific infestation you can use. For example, whenever you are using for Haemonchus, either mebendazole can also be used. Textbook says, but you will be getting delayed binding response, or there won't be any good efficacy will be there. So in such a conditions, according to your experience, you can select the antibiotics. So according to my experience, Haemonchus means we treat it effectively with the ivermectin, very effective. So such a days you can use, but according to your practice, you can come according whether it is useful or not. But it is advisable, no problem. There are so many other good drugs are available now that we can use.
Okay, sir. So in case of, you said that in case of anemic patient, we shouldn't give IV fluids. So in that case, can we give a stomach tube to insert the fluid within the rumen, or shall we use only the feeder again?
Yeah, you can do it's a small kids or anything, you can give it in the feeding bottle. You can put the electral powder and you can do oral rehydration can be the best one. That is the best choice. Okay. One question that we use tandem injection IV after mixing with the saline in polyencephalomalacia. Is there any recommended dilution ratio? There is no recommended dilution ratio. For example, when you are taking 10 ml of thiamine injection, you can add equal amount of 10 ml or 20 ml of saline, and you can inject it slowly. That is one line of treatment. Or you can mix it with 100 ml of saline, and you can mix this thiamine. Anything you can. Instead of giving directly, just you are giving, mix it with the saline to avoid the untoward reaction of anaphylaxis. That's all. There is no recommendation of equal dilution and all like that. Okay. You can mix it with for 10 ml of thiamine means you can mix it with the equal amount of normal saline, and but you have to give slowly IV. That's it. I think now in Bangladesh, everyone is being well aware of polyencephalomalacia and use of thiamine. I hope so.
Yes.
Even in remote villages, they started using the treating the polyencephalomalacia. That's very happy to see.
So Ridwan, do you have any more question?
No, I'm finished. Thanks to the sir.
Okay, Ridwan, thank you so much. So I want to back to Jamal sir. Sir, I think maybe you have few more questions. So, sir, would you please unmute your microphone?
Oh, sorry. Thank you, Dalwar. I don't have any further question at this moment.
Okay.
I will
Thank
raise
you,
my
sir.
hand if I have any further. Yeah.
Okay, sir. So we have some questions from the audience. I want to show the questions in the screen, sir. So there is a question.
Why we cannot give atropine in enteritis case? Is that question?
Sir, question in the screen, sir. How milk overload cause enteritis? So
Yeah,
then
so milk
is there?
enteritis. Yeah, in few cases, not in all the cases. Sometimes they may be feeding the kids with. Frequently, they used to feed the kids with milk, hand feeding. So in such a condition, there will be distension of the abomasum will be there. Sometimes there may be proliferation of Clostridium perfringens in the abomasum. That may lead to the same conditions like ruminant acidosis. Metabolic acidosis will develop. So after developing metabolic acidosis, the animal will go for coma stage. The animal will be in the latent recumbency, cold extremities, and that will lead to, as we explained, that floppy instrument. The same condition like floppy instrument. So then we have to restrict the milk and give the fluid therapy, and we have to revive with the sodium bicarbonate. So that naturally occurs when they are milk feeding with milk overload. That's the main cause, main reason behind that. Okay.
Okay, thank
The
you,
other
sir.
question is that,
So then other question is that when we should apply the doramectin IM in goat.
It has gone already.
yeah, you just see many literature says doramectin IM can be given. You follow the literature whether it is recommended for IM use or subcutaneous use. You just verify it, then you can give. So when you should means just whenever you come across a condition of like a tick infestation or lice infestation or mange or homunculus, in all such conditions you can use this doramectin. Sarcoptes, soraptis, homunculus, all these things you can use. And one question is that why we cannot give atropine enteritis means when you give atropine is a parasympatholytic. So what will happen naturally? It will symptomatically the next day you will be feeling the animal is not passing that because the intestinal motility will be impaired. There won't be any motility. Suppose the enteritis is due to the bacterial origin. So the endotoxemia, the toxins will be retained in the intestine. It will be absorbed more, and the condition will become worse. That's why we are advising we should not give atropine in case of enteritis. Okay. They used to give it as a symptomatic treatment, but it is not advisable. One question that Boyer cross kid age 2 days, increased breathing rate after 2 hours of birth, intensity of breathing increased with increasing environment along with 1 degree rise in body temperature. Now, what to do? Only hydrotherapy or ketoprofen is going on. No approach. In such a cases, just give 1 ml of sodium bicarbonate. So the respiratory disease may be due to respiratory alkalosis, maybe the metabolic derangement. So in such a condition, you can metabolic acidosis, respiratory acidosis. So you can go for 1 ml of sodium bicarbonate intravenously, and you see the temperature whether it is subnormal or normal. And if it is a subnormal, then you can keep it as a warming box, as a small bulb can be put, and you can keep it in that place and all. If it is having a temperature, high rise of temperature, then you have to think about any neonatal infection. But it won't occur within 2 hours. So respiratory disease within 2 hours of birth, you can control with sodium bicarbonate injections.
Thank you, sir. So we have few more questions from the audience.
In case of goats, levamisole is said to be used with care, and why and how. As already told, levamisole can be used at the proper dosage. No issues will be there. 7.5 milligram per kg body. 2.5 milligram as a immunostimulant. No problem.
Okay, sir.
Please recommend a line of treatment for mycoplasma treatment arthritis. Same tylosin, all mycoplasma. Please keep it in mind, all mycoplasma treatment, tylosin. Whether it is a contagious capillary pneumonia or mycoplasmal arthritis or keratoconjunctivitis, infectious keratoconjunctivitis, in pink eye due to mycoplasma, everything, tylosin. Do you have tylosin there? Injection?
In Bangladesh, we have sir, tylosin target.
Each ml contains 100 milligram is there. Each ml contains 200 milligram preparations are there. Very effective. Very effective.
Yeah, we have 200 milligram per ml, but currently it is not very available. I think government
very
ban it.
effective.
Yeah. So currently, most of the cases we are using oxytetracycline for the cases of microasthma.
10 mg per kg body weight.
Yeah.
Very effective. Suppose we may be coming across a sheep flock or a goat flock with a severe cough, nasal discharge, not responding to your treatment. Suppose when we are doing a postmortem with the thoracic cavity, we can able to appreciate the serous sanguineous fluid. Pleural effusion like thing will be there. And the lungs will be having a cheesy appearance, exudate will be there, cheesy white appearance will be there. It's a classical sign of a contagious capillary pleural pneumonia. Some animals will be having edematous head will be there. Jowl edema will be there. Mucous membrane will be normal to congested. So you think about this CCPP. So you start treating with tylosin, you can prevent mortality in that one. Definitely.
Thank you, sir. We
I
have
have a question.
one more question.
Sir, I have another question.
Yeah,
It's
yeah.
very unusual in Bangladesh. Sometime a few days ago, I have visited on the goat farm. There is one of the bark. The age is not more than 3 years, but the bark are very commonly bite another goats. Very common. Just because any crowded condition or healthy condition, just biting another goat. There is this unusual case. But is it any deficiency syndrome or any other problem?
What I couldn't able to hear properly. What is the problem?
The biting habit, when it's
Some
present
other
in
sound is coming.
other goats, just you can frequently bite the male and female each another bite. That's a frequently biting problem in the flock. The bark is around 3 years ages, but the problem is continuous biting the other goats. Is it
Oh,
any deficiency problem or others any problem?
the goat is biting the other goat.
Yes, sir.
Okay, okay. So just to see whether there is any presence of any mange infestation, anything like that, any signs of skin lesions. Just to verify there are any skin lesions is there or not, like erythematous lesions or crust-like lesions is there or not. Just we have to verify. Okay, and also verify the feeding pattern, whether the feeding pattern, what type of feed they are giving. Okay, especially the phosphorus level, whether they are giving bran, excess bran, and all that we have to verify and we have to come. Just you put a message to me. Let me go through that. Okay, and
Okay, sir.
you have to verify any osteodystrophy fibrosa condition like that or not. When they are feeding excess bran, there may be due to some excess phosphorus level. That and all we have to verify.
Thank you, sir.
I think we have covered all the questions asked by the audience. So at this moment, I would like to invite Professor Dr. Mizan Rahman sir for your opinion, or if you have any question, then we can discuss with the Shitarans. So Mizan sir.
Please unmute your camera. Please unmute.
Sir, would you please unmute your microphone, sir? Yeah, thank you.
Oh, it has thank you, Shivaraman. I think this
Yes.
session is very, 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 very useful for the field practitioner. So there is one question asked by field vet. Can you please answer that?
Yeah.
Did you answer it already? The questions. The question is
Sometimes.
on the
Oh,
screen.
yeah. Mohammed Arifuddin and also sometimes in case of parasitic infestation, the patients are very weak. Yes. In these cases, which approach is better? Deworming of patients or supportive treatment followed by deworming. So you can deworm it. So you can deworm it, and consequently after deworming, you can go for the supportive treatment. So that is a well and good. So you can deworm the animal, then you can give the supportive treatment.
Okay, sir. I have one. I think one question. In case of listeriosis in goats, you have recommended penicillin.
Yeah,
And do you recommend it to inject intravenously or intramuscular?
intramuscular.
Penicillin.
Intramuscular. If you are having penicillin preparations like benzathine, penicillin, and all, you can go for intramuscular injection is more than sufficient. And some veterinarians, they may not get the penicillin alone. They may be getting a combination of penicillin like streptopenicillin. If it is available, that also can be used. 40,000 to 60,000 international units per kg body weight intramuscular. If you are not having penicillin, you can go for oxytetracycline, 20 mg per kg body weight can be used.
Okay, thank you. What are the other diseases that can be confused in the listeriosis in the field? because you know
Yeah,
in the field condition there is no diagnostic possibilities.
yeah, yeah, yes, yes, yes.
So the doc or the vets have to rely on the clinical sign symptom in the
Yes,
field.
yes. Listeriosis can be differentiated. There are two conditions. Only the thing, polyencephalomalacia and listeriosis. Only these two conditions will show the neurological signs. So in polyencephalomalacia, sometimes the menace reflex will be absent. People may be dilated. Nystagmus will be there. Staggering gait will be there. In listeriosis, circling will be there. That will be going on in circling, and sometimes the facial paralysis will be there. Unilateral facial paralysis will be there. In polyencephalomalacia, there won't be any facial paralysis, only neurological signs, nystagmus, incoordination, ataxia. Here, facial paralysis, unable to close the eyelids, ptosis, venous reflex may be absent in one side, droopiness of ear in one side, cut may be retained in the oral cavity. So you can differentiate these two things: PM, polyencephalomalacia, and listeriosis. So you can treat it combinedly. Whenever you are treating this listeriosis, you add thiamine also. Whenever you are giving penicillin or OTC, oxytetracycline, for treating listeriosis, you supplement thiamine also. So the response will be very much good.
Okay, thank you. I think it was a very good session, Shivaramam. Thank you very
Thank you.
much. And it will be very, very useful for the field heads. I know in the field condition, we don't have any diagnostic facilities. The doctor can diagnose many important diseases with only relying on the clinical science. So it is very useful, and thank you very much for your time and for all of your reports for us. So thank you very much. Oh, I think we will not continue so much. It is almost 2 hours now, and we will keep in touch and we will arrange another maybe series of presentation with you in next in another few months.
Yes, yes.
So thank you very much. Thank you
Thank
very
you.
much again.
Thank you, Mizan and team for their wonderful work. Thank you, one and all. Thank you very much. Thank you.
Okay, Taylor, you can conclude now. There, you can end the session.
Thank you, sir.
Okay, thank you, Shivaram.